this rasa and raktavaha srotas. Okay. So Rudrogas, once we studied in BAMS or PG, whatever it may be in Kaya Chikitsa, we are afraid to treat because that is an emergency. Most of the public also feels it is a emergency and a critical disease. But basically Rudrogas are easily treatable and reversible with our system. If you are giving a confidence to the patient, so new patient may difficult to come, but already what you are practicing in general practice, existing patients, if they got any cardiac issues, they will come. So don't lose that patient and do practice. Further toning, I am giving a confidence in this session. Mostly I will try, right? So that leads the confidence of the patient parallelly of your practice, both. So Hridaya is a mole of Rasavaha and Pranavaha Srotas. You know very well. So then second thing is like Vyanavata, Sadhaka Pitta and Avalambaka Kapha is a Tridoshas is mainly acting on this diseases, and Sadhya Pranahara Marma. This is one of the three marmas, that is Sirah, Vara and Vasti. So generally we will take in Vasti means only bladder, but actually you have to take the Vasti means total renal system. Don't forget it is, because that is also related to cardiology. That's why I am saying. So Vasti on Paribhasha in Ayurveda means not only bladder. Why? Because we are giving Vasti, always Vasti. But according to the disease told by Acharyas, Vasti have to treat it with total renal, considered as a total renal system. So once Vasti Abhigata means that causes the total failure of the renal system also, right? This is generally this Hridaya is formed from Sonita and Kapha in the embryological level. So generally we will classify, you know very well, that is according to Charaka and Madhavakara and Ashtanga Hridaya, 5 types of Hridaya Rogas. But Susruta described Sannipata is not, right? So that is Vataja, Pittaja, Kapaja, Tridoshaja and Krimija Hridrogas. The most common heart disease in the allopathy, just it is coronary artery disease, hypertensive heart disease, heart failure, cardiovascular disease and congenital heart disease. So the terminology is different, but this coronary artery disease, ischemic heart disease, pericardial disease means inflammatory artery disease, this comes under coronary artery disease. This hypertensive heart disease also later on develops as the heart failure diseases. So that's the pulmonary heart disease and valvular heart diseases. And the cardiovascular disease also interlinked with this coronary artery disease, that due to the ischemia and the dilatation of the vessels and the lack of proper blood flow. So the congenital heart diseases are different. That comes from the genetical, that is rheumatic heart disease, septal disease and valvular disease. So valvular disease has come from, may formed from congenital or later on that. So that's the reason I placed in here this heart failure and congenital disease, right? So 5 types of Hridrogas correlated generally. So when the patient comes with like atherosclerosis or MI or myocardial infarctions or any like cardiac enlargement or left ventricular hypertrophy or left ventricular hypertensions like conditions, how you will consider is according to Ayurveda, which dosha is involved in that. So if you know little bit, this is a basic doshas only, just remind the first year Vata Lakshanas, Pitta Lakshana, Kapha Lakshana, simply it can easily understand the Hridrogas and you will treat easily. No need to go deeper pathology. That's the reason in Ayurveda it's not discussed that much deeper actually. So why? Because the therapy is there, treatments are there, but you don't need to go that much deep pathology. The simple pathology is there, and it is simply we can understand the heart disease. So generally atherosclerosis means, you know, atherosclerosis that damages the vessel and makes the constriction of the vessel, that causes the bleeding in the organs, may heart, brain and any organ in the body, that is due to the bleeding, that forceful bleeding due to only vata. No any dosha will involve. Later, initially may medho and kapha involve, but the damage that causes the infraction, atherosclerosis, that is due to the only vata. So, because that is actually all atherosclerosis disease maximum, this is avarana vyadis. See, that is strokes. Every stroke is avarana vata vyadi. So we will treat it as a vata, not like kapha, right? So second is pericarditis, inflammatory disease, that is pittaja hridrogas. There the swelling of the heart chambers and the layers of the heart, outer layers also, the inflamed. So that is pittaja hridrogas, and myocardial infarction and chest heaviness, that cause that is due to the kaphaja. So that called as a kaphaja hridroga also. Chest pain, heart failure, and rheumatic heart disease are sannipataja. So in rheumatic disease, some may in some people that develops from congenital, and some in people develops with amavata. So in that ama, vata, and rakta, the kapha sometimes also involved. So that is a sannipata, different. So that's the reason that comes under sannipata. Krimija hridroga. One parasite is there that causes the pericarditis. So that damages the pericardial muscle. So that leads to the cutting pain and swelling. That is Krimija in classically explained in our Samhitas. So that is also we will discuss later. So common etiology is excess in Ayurveda, excess emaciation, purgations, over purgations like panchakarma also leads to the cardiac diseases, excessive worry, fear and stress and anger, emesis and ama. Already I said ama dosha, that is ama, and trauma and excessive consumption of hot and very hot and very heavy diet also, and consumption of heavy kashaya rasa pradhana, that leads to the karsha, means emaciation, and suppression of the natural urges, that increases the vata. That's the reason. Don't that is in Vedhan Adharayeta, that is a simple, I said already in a Sutrasthana. Everywhere application in Hudraga only Sutrasthana only. Just remember it. Don't go Charaka, Chikitsa, Nidhana, don't need. Simple Sutrasthana implemented in the Rudragas. So Vedhan Adharayeta. So why means that increases the vata. Simple. When you are stopping this urine, then pressures over the brain, pressures over the heart also leads to damage anywhere may. So like same, stool, whatever it may, vegan. If you are stopping your Zumba, that also sometimes causes the damage of the vessel. So the common pathological pathogenesis is high cholesterol and rich diet, sedentary lifestyle leads to mandagni, then rasadrushti, hyperlipidemia, and kapha pitta rakta medha dhamani pratichaya. Srotoruja, vayu uruja, sola hridroga. So that causes the sola and hridroga. That is both same. The pain and then leads to MI or infraction. That is hridroga. Agnemania, hyperlipidemia, atherosclerosis, obstruction of arteries, that causes the hridroga. Simple pathology. So in this case, what we are seeing, this is normal artery. See, what will happen in atherosclerosis arteries, that atherosclerosis due to that tissue what is present in the arteries, that damages with fatty depositions, that leads to the narrowing of the vessel, then causes the constriction and atherosclerosis, that leads to the over pressure over the heart or any organ, leads to the obstruction, forms a plaque, and leads to the bleeding or stroke. This is, see, this is condition, tear in artery wall, then deposition of the fatty material in the wall leads to narrowing the wall, that leads to the clot of the blood also in that organ. So varicose veins, everything where there is a clot and atherosclerosis is present, this is the only cycle of pathology, simple, flat. So common symptoms In Hridroga, Bhuja, pain is there. In modern also same symptom. Swasa, dyspnea, Kasha, Asya Vikaras, sorry, Asya Vairashya, Trishna, Vaivarnya, Morsha, Hekka, Kapha, Klesha. So these are the symptoms. Same when we are correlating with modern also. Classically, Acharya said the same symptoms present in the modern aspect of cardiac diseases. So already I categorized the cardiac diseases. So we will discuss about coronary artery disease. So coronary artery diseases are the coronary arteries become closed with fatty deposits, already I said. So that leads to the damage of the heart muscle, then leads to the myocardial infarctions later. That is coronary artery disease C. That causes the heart attack, angina, arrhythmia. Atherosclerosis obstructs and cardiac heart attack, angina, arrhythmia. This is one slide only. What is MI? You know? Yes, right. So myocardium is a layer of heart muscle. So in the small bleed, that is the first sign of first stroke. If the patient aware in that condition, that is no need to go any surgical intervention, no need to go any cath lab for catheter, right? So simply we can treat with better treatment in our system. If it is in a mass stroke, no one can survive. They collapse in even bathroom and bedroom also. Even allopathy also not safe at the stage. First stroke and second stroke, if they aware, then they will save with our system also. So generally what happening today, even though 40 to 50% of coronary arteries blocks also underwent catheterization, nothing stent. So that may damage later. I will discuss why stent is not advisable. I will discuss later on. Okay. So the common symptom of MI, first attack of the heart attack, is pressure in the center of the chest, pain in shoulders and neck and arm, chest discomfort and fainting, sweating, nausea. These symptoms also comes in Mudhavarta also. See the differentiation. First of all, whether this is a Mudhavarta or cardiac stroke. Differentiate karna. Mudhavarta mein mostly the Mudhavarta comes with one. No? Yeah. Yes. Right. Yeah. That differentiation is only one thing is in Mudhavarta the most discomfort first starts, later on that chest congestion, later on that pain in the chest, not in the hands. So pain in the chest is not a cardiac problem. So you should clarify and differentiate it. First, any cardiac problem, the first symptom is chest heaviness, not udhara, not bloating. So same like many people comes with, sir, I have lot of pressure on the chest, I feel heaviness, and same thing you have to question them. So you have any bloating in abdomen, first of all you have to check it. Later on that when you are taking food, what happening, is digested or not, everything has to take, even the cardiac patient also. So later on that you have to decide chest congestion is there or heaviness is there. Then any pain in the arms, may sometimes pain not get in the arms also, in the mild MI cases. So the only thing is discomfort and sweating is one of the symptom. Nausea is also present and chest center pain is common and major is mild dyspnea is present. So that is the differentiation in common with the Udhavarta, means bloating and causes that, sometimes like we can treat, see like GRD also feels like sometimes. Okay, you have to differentiate them. Yeah. So Susruta, Krutsula actually tell in Gulma. So Gulma is the Sana of Hridaya. You know, already Dr. Ravikant sir already told, right, on the day of second or third day. So in that Krutsula is one of the symptoms. So that's the reason Gulma Pratishedana Adhyaya, Susruta is said in that Gulma Pratishedana Adhyaya. So this is only reference. So angina. So you know, angina is simply is chest pain and arrhythmia. So it is a irregular and beating of the heart is arrhythmia. Just to know only I made a slide. Okay. Ischemia. What is ischemia? So reduction of the oxygen to the organ, any organ is nothing but ischemia. Maybe brain, maybe heart, maybe kidney, maybe liver, whatever it may be, hand also. So reduction of the oxygen and the blood flow is nothing but ischemia, right? So that under simple vata. Simple, it is a vata. It is obstruction, that is avarana, it is a vata, simple. So how we will treat, later on we will discuss the treatment, but we have to know first of all. So pericardial, already I said in inflammatory heart disease are nothing but pericardial diseases. So the most causing factors are, you know, cigarette smoking, uncontrolled hypertension, uncontrolled cholesterol, nothing but hyperlipidemia, uncontrolled diabetes, and family history may, and stress, tension, and obesity. Nowadays, the major problem is obesity. So why? Because we are eating, not going any exercise, not doing any walking like exercise, not taking proper limited diet, and we are taking lot of carbohydrates, rich carbohydrates, everything leads to the obesity, you know. So that cardiovascular disorder associated with obesity is simple: hypertension, stroke, coronary artery diseases. This is the global CVD, coronary vascular diseases death rate, now in 17.9 million, total death rate of 32% global death. Every day we are, after COVID also, we are seeing a lot of people is suffering with suddenly death due to the cardiac arrest, because sedentary lifestyle and because of improper exercise, improper management of stress, all these causes. This is a major issue. Particularly myocardial infarction is the basic death cause of the most of the cardiac diseases. See, in these 26 years, 34% of population is death due to the myocardial infarctions only. So generally, what is the treatment for any ischemia and infractions? Can you tell? Anyone? Commonly we will listen, sir, we will went to the hospital, they done angiogram, later on that this much of block is there, this much of block is there. So on the table, doctor, sir, this is emergency, we have to do catheterization, nothing but stent. So otherwise they will die. If really people will die with 40% to 60% stenosis, is it fact? Not. Right? Why? Means even though you have done the catheterization, that also leads to the another further blockages of the vessel later on that. So that is the only simple temporary relief only. But nowadays that is very, very common. So they are taking a lot of medicine on lifetime while going 20 years, 15 years. Later on that, once if it is stunt fails, may causes sudden death also in the after stenting within 1 week. May if it is success, it may later on like 15-20 years they underwent to the bypass. So that is happening today, right? So it is generally heart have lot of bypass channels. If one vessel is blocked, that bypass the another vessel to the heart. That is God's gift. That is human heart structural anatomy. So most of our what we are doing, the mistakes, that causes the non-bypass of the heart block, that causes the death actually. So if anyone have a block identified, then after that, if any people will start their lifestyle changes, then definitely that blocks will reduce and the flow of the blood will bypass naturally. How? I will explain later. See, general conventional treatment is only PTCA, CABG and allopathy medical management. Even though we are afraid to treat cardiac diseases because of only in emergency of fear, not emergency, only fear. See, So we give the confidence to the patient. If they are already your patient, if anyone comes to reject this, stunting everything, then explain them and properly educate them and treat well. How to treat, I will explain, but you should study and do your own also. This is only model to how to understand, right? What will happen in stunt? So they will stunt with balloon, they will insert the catheter in the arteries, later on that blood will flow. But generally our arteries actually has a lot of vasodilatation nature is there. But what will happen here? If they done the catheterization, natural vasodilatation will damage. So this stops the vasodilatation and permanently reduces that dilatation. Later on the same, even though catheterization, later on the same plaque, same block will come either front or back, whatever it may be. So what is the use of this catheterization? I think you can understand. Okay, that is a modern concept, whatever it may be, but according to our system, how we have to treat, we'll discuss. Our questions on in our mind, whether Ayurveda treatment is effective improving the patient with ischemia like cardiovascular disease, whether it can really reduce the mortality rate, can really avoid the angioplasty. That's what we are discussing. So most of the people afraid for this, if they are not going any angioplasty, they may die because of fear, because of stress. Okay, can we treat confidently? Say yeah, thank you. Yes, definitely yes. How? So these, how we will consider this disease in Ayurveda? Simple. This is Vata Kafacha Hrudroga. What is Vata Kafacha Hrudroga? Any ischemia, first is Vata, then is Kapha. Simply Avarana, also I said already. Second is Srotho Rodhana, that damages the vessel and causes the block of the vessel, leads to the disease. Apanavayu Rodhana or Dushti. This is the major cause. Vaghana Bharayedhat, that improves the Apanavayu, that damages the remaining Vayus. Right? Treatment principle, simple. Sroto Shodhana. You know Shodhana very well. How many Shodhanas we have? Vamana Virechana Vasti Nasya Rakta Mokshana. Right? And another more Shodhana is Bahya Shodhana is Abhyangana and Svedana also Shodhana. Okay? Patya. What they have to eat, what they not. We have to tell them which type of diet they have to take. Vyayama, nothing but exercise, yoga, meditation, walking, running, whatever it may be, sports, anything. Hrudyam, after the treating all this, we have to strengthening the cardiac vessels and re-strengthening the muscle. Because of that block, heart take lot of load on the, you have to strengthen the heart remains. That is Hrudyam. Hrudyam, you know the meaning of Hrudyam, right? I think, can I say? Hrudyam, that improves the quality of heart, that gives the strength to the heart. Nothing but Hrudyam. Simple. Methodology to recovery, only 3 months diet is enough, or 4 months maximum. If anyone is not misleading with the diet, 4 months maximum. You can choose Panchakarma. Simply for 3 months, different Vamana Virechana on the intervals. Regular exercise for 3 months. If any diabetic patient, you have to monitor the diabetes also. Sugar level checking. In the diabetic patient, most of the atherosclerosis due to diabetic patients. So that's the reason I added this one. So we have to monitor the diabetic value also. See, simple. Fruit, veggies, whole grains, plant-based proteins, healthy fats. What is healthy fat? Whether ghee is healthy or not. Can you tell anyone? Healthy or not? Can we take ghee to the cardiac patients or cardiovascular patients? How? How can you explain? If anyone taking snehapana, taken, your weight is increased or decreased? Ma'am? Yes. If you are taking snehapana, your weight will decreases, not increases. So reduces. So simple. If you are taking the saturated and amino acid good fat, that reduces your weight and improves your HDL and reduces the LD and VLDL. Simple. In modern aspect of talking. Okay. So once diabetic, once cardiac patient, don't take ghee. That causes the heavy fat in your cholesterol. So you can take that refined oil. Yeah, very much. Is it suggestible? Yeah. So you have to learn. Don't go like all. So you have to study according to Ayurveda. So snehapana simple. That is keto diet. Snehapana keto. When you are giving the keto diet, automatically the body itself reduces the bad cholesterol. Body itself synthesizes the good cholesterol. Liver reactivates and HDL improves. Automatically, the total muscle and vessel fat and muscle protein will improve and strengthens the heart and arteries. Simple. So ghee is a lot of amino acids and good saturated HDL fat. If it is a pure, not a dalda, right? Okay. Simple. Healthy diet, fruits, vegetables, and reduce the sugar. Carbohydrate is a major cause of atherosclerosis. You know very well. That improves the bad cholesterol in the body, not only the non-saturated fatty acids. So rich carbohydrate is a very danger. Reduce your sugar and reduce your carbohydrate rich food and intake. You have to improve the good vegetarian based protein and improve your whole grain and fiber and select your diet with 35% of carbohydrate, 40% of protein and 30% of good saturated fatty acids. Then this is the only treatment in that. Is any difficulty? Simple. See, all these you can do. Nasya. Why you have to add in heart disease nasya? You know, already I said that is vata, avarana vata. That may cause a stroke in the brain also. That, you know, sirogata vata nasya is a first line of treatment. And second, svedhana. First, you have to abhyantara svedhana also. When you are doing abhyantara svedhana, that over electrolyte like sodium, chlorides and excess in the your amount of it will comes out and excess fat will also comes out from the svedhana. That reduces the higher lipidemic condition. And the second is vamana, you know vamana, that reduces the kapha dosha and reduces the fat also. And pathologically, snehapana, already I said, rakta mokshana. In few cases, if like varicose veins, deep vein thrombosis, we have to do rakta mokshana in the treatment principle. Virechana, vasti, abhyangana. Abhyangana and svedhana is okay. Vasti. The center major part is dhara. You have to remember it. The most atherosclerosis and the diabetes due to not only high eating carbohydrates, even though who are very lean, they are getting strokes also because of only stress. See, the higher atherosclerosis due to the stress, not only eating carbohydrates means that much of obesity they will be gone, have to go. But even the lean persons are getting cardiac arrest, brain stroke due to atherosclerosis of the stress and kharsha. Already first point I said the increasing vata factors. So you have to do dhara. Which dhara? Okay, Sirodhara. Which dhara? What? Right? Takradhara. Good. Takradhara is the first line of treatment in all hridrogas and stress related diseases. not Tailadhara. Simply mind it. Why? Because after once if it is in a brain stroke, then we will treat like Tailadhara and Sirovasti like. But while reducing the cardiac, we have to reduce the cardiac disease. You have to give Takradhara. Takradhara is the best treatment for psychosomatic disease. Even though Takradhara is very good for skin diseases, all Kushtarogas. Okay, remind it. So we have to do exercise on not in under AC. Okay, don't go treadmills. Go outside, do aerobic exercise, and even atmospheric exercise also. Not with 20% temperature of AC room. And I am doing exercise in every day with treadmill. That never gives a good result to you. So sweat has to come out. Sweat has to come out. So yoga. In that yoga, you have to do maximum extent of asanas. That gives a lot of sweating and improves the biological function of every organ. You know very well, yoga is a very, very better than as compared to generalized exercise. And pranayama. Why I suggesting pranayama means when you are taking a lot of oxygenated air into your lung, that reduces the heart rate actually. Little bit speed up of the heart rate. Simply, when the heart rate will reduce and controlled by your pranayama, then the lifespan will increase. Then oxygen will get a lot of, already ischemia, already what I said, lack of oxygen, right? So that ischemia will reduce with the pranayama. That improves your oxygen holding capacity in your body. That improves the quality of life and improves the lifespan also. That is important. And meditation to control the stress and everything. Right? Simple. While you are doing this, while you are doing simply exercise, the vasodilation will occur. The simply vasodilation means generally any plaque, any block gradually will reduce. So that is the reason I suggest. These are the medications you can apply according to the Rasaguna Virya Vipaka in different diseases. My best simple drug is Arjuna Lasuna Ksherapaka. I advise all Rudrogas. Why? Because Arjuna is a best Vata Kapahara, Lasuna also Vata Kapahara, Avarana Vatahara, and Kshera is Pitta. Why? Because Sonita, Rasavar Sroto Dushti, right? So Kshera is Brahmana and parallelly Pitta Samaka and Virayachaka also. So that is I suggested Lasuna, Pippali and Arjuna Ksherapaka. Right? These are the drugs. So sorry. These are the rasaushadhas we can use in according to you. So in that I will explain about Nagarjuna brothers. Okay. If you are facing anyone facing like hypotension, what will you suggest? Generally, water, lemon, salt, right? But even though if you are suggesting every day 2 liters of lemon water, but BP never comes up in some cases of cardiac enlargement cases. So it under like 90 only, systolic, 90. So in that cases also they feels like heaviness of head, reeling, sometimes weakness, all these symptoms they feel. So this Nagarjuna brothers improves the hypotension to normalize the BP value and improves the quality and reduces the swelling of the heart and quality of the cardiac muscle. This is why I am suggesting is remaining Hridayanvarasa and all these are protecting the cardiac muscles and everything, but Nagarjuna is specific for that also. Hypotension. So generally we will suggest simple. So hypotension, Nagarjuna brothers, mind. So clinically I am seeing lot of cases, that's the reason I am explaining. Hypertensive disease is nothing, getting angina and heart failure. Hypertension, Avaramata. So hypertension is a big question to Ayurveda. How we can consider as hypertension in Ayurveda? There is no terminology in Ayurveda, right? There is no terminology in Ayurveda. But already I said in the initially, we have to see the only dosha pradhana. So simple. This is avarana vata, mohoda vata only. So that causes the atherosclerosis. Due to that only, hypertension may increase, stress also, mohoda vata, apana vayu and all these conditions, hypertension will increase. So that may cause heart failure, aneurysm, kidney failure, stroke, and all these things, blindness, vision loss, everything. So simple. Vataja pradhana. If you are feeling it's a vataja pradhana on nadi and the symptom, give this combination pittaja pradhana and kaphaja pradhana. Meditation, pranayama, exercise, and common is sarpagandha, jadamansi, archana. These are the gunshot drugs. You can give it to any hypertensive patient. Okay? Heart failure. Congenital heart failure is also known as heart failure. So, coronary artery disease, cardiomyopathy, and pulmonary heart disease are the major cause of heart failures. So, ischemia, cigarette smoking, hypertension, obesity, diabetes, and valvular heart disease. Same. Shortness of breath, fluid retention, fatigue, loss of appetite, weight gain. How we can consider in Ayurveda? Vata sopa, vata kapha hrudroga. Okay? See, vata sopa chikitsa, hrudyam, aushadha prayoga, simple. So you have to give dashamola, patya punarnavadi kashayam, bala sharyakadi kashayam, sometimes, and sitarikadi kashayam, all these are there. Vata sopa hrudroga, sofagna chikitsa, hrudyam, motral aushadha prayoga, simple. Line of treatment is motral aushadha prayoga. These are the drugs. This is main important. When you have a cardiac enlargement is there, when the cardiac muscle function is very weak, you should do Hridaya Vasti. I think you know all these Kati Vasti, Janu Vasti, Griha Vasti, everything. But Hridaya Vasti may not practice everyone. Hridaya Vasti. This is a very good treatment. I am treating a lot of people. Their cardiac function is improving. Regurgitations are reducing. Their valvular problems are reducing. So you can, according to the dosha, say, if it is in a vata kapha and already it is a shodha is there. So if it is in a vata kapha, use simple Dhanvantar Tailam. Simple. If already shodha is there, if it is predominated vata, Narayana Tailam is there. If any kapha predominancy is there, use Kottam Sukhadi Tailam with Dhanvantar Tailam. So vata is common, predominancies will change. That is the only treatment. Just simple tailas. Okay? Cardiovascular disease, you know very well. Varicose veins, atherosclerosis, thrombosis. Congenital heart disease, you know, rheumatoid arthritis and cardiac diseases all. Rheumatic heart disease, septal disease, valvular heart disease. Already said Krivaja Hrudroga. Really, no one is seeing it every time, but it's present. So this is the article published in paper, Krivaja Hrudroga. So on the days, okay, identified Krivaja Hrudroga. So I created a lot of, see here, EF is very low, 22%, but they have metal regurgitation is 2% and tricuspid regurgitation 1+ is there. Dilated LV and LV, global hypokinesis of LV, grade 1 diastolic dysfunction, mild MR is there. So after my treatment, their metal regurgitation total cure. Tricuspid regurgitation also total cure. And dysfunction is also reduced. I think you observed the same patient, Ravanama. Right? See, this is one of my case, that cardiovascular case. This is a trauma of right upper limb. So, thrombotic occlusion of the subclavian artery, axillary artery. So, in the modern doctor is suggested, see, left. See, this is This is they suggest the treatment, right brachial biopsy with graft. What suggested? Right brachial biopsy with the graft. After my treatment, okay, I will see the video. So this is one of my case. See how much the EF is there? 30%. Later on that, 46%. 63%. It is improved ejection flow. This is actual heart failure case. So simple prevention of the hridroga is better than the cure. So first we have to suggest the patient with a symptom of cardiac. We have to suggest what I suggested: diet, exercise, medicine, whatever it may be. So you have to change. They have to change the diet and lifestyle modification and give the rasayana therapy. Also later on that after treating. So in this case, she has an age of 74. See, 68 at the time of treating. Later, she lived up to 76 years. She gone. Like general death only. Nidana Paridarshana only. This is the combination of yoga and anupanas. Simply in the cardiac diseases. See, Arjuna Churna, Ki Durta Kuda, Hridroga, Jirna Chara, Rakta also, Pusta, Vedanga Churna, Gomutra, Krimija Hridroga, Nagamala Mula, Buddha Haritra, Kasaswas, Pushkara Mula, Udeshura, Swasikasa, Tikka, Drakshana, Sariti, Kirtizo Hridroga. See all this. Nagarakwana. Thank you.